Next month, over 500,000 people will renew their private health insurance. But what are the options if you're looking for the best deal? So far this year, it's been nothing but bad news for those with private policies, and those on outdated plans will be particularly hard hit. I'm joined now by health insurance expert Dermot Good, who's going to talk us through the best possible deals. Morning, Dermot. How are you?
Morning, David.
Overworked at this time of year?
This time of the year tends to be pretty busy because so many renewals, as you said, fall at the 1st of January. In fact, right through January. So, you have so many people basically getting bad news, and they're trying to get through to the insurance companies and trying to get their cover reviewed. So, look, it can be pretty challenging.
And it is bad news, isn't it, for most of us?
Unfortunately, it is nothing but continual price increases at the moment. So we all know most of the rates went up in October. And I just see now there's more increases coming through from the 1st of January. So VHI and Leia will be increasing between 12 and 15 plans each by roughly 10%. Now, some of these plans, to be fair, didn't go up during the year. But once again, it's happening at the worst time for consumers. So they're all getting those renewal notices. I mean, if you're lucky, you'll get away with 10%. Most people are facing 15%. If you're on some of those dated plans that you already mentioned, some of those plans are going up by 25 to 27%.
Ouch.
Yes, so I would say to anybody now, when that renewal notice comes through, brace yourself. The worst thing people can do, David, is do nothing, what we call auto renewals. And this is particularly for older people, people who are afraid of making any changes to their cover because they're using it. And what we find is that they see the premium, they just let it roll over because they don't want to engage because they're afraid of making a wrong decision. And I would say right now, they need to engage because even auto-renewing on the same plan, they're changing the benefits all the time. So you might end up paying 25% more for less cover. So I would say to anybody now, if you have elderly parents or older parents or relatives or whatever, all those young people now maybe who have time off over the Christmas, you need to help them do the reviews because they're terrified of making changes and they're missing out on genuinely amazing deals, often with the same insurance company. I think 50 to 55% of people who switch will get a better deal without having to change insurance company.
Okay, it can seem incredibly complicated and it can seem incredibly off-putting to people to go looking through the different options, can't it?
They don't make it easy. And look, there's 340 odd plans with, ridiculous plan names. So what I would say to people right now, like it's good for me, David, it's not good for consumers. But what I would say to people, one phone call is all you need to make. So if you phone your existing insurance company right now, and just tell them you can't afford the renewal that's just come through, and tell them what your budget is, and you sit back with your mug of coffee and you challenge them to go through all of their plans and find you a plan. Now, here's the key thing that gives you similar cover, not identical, similar cover, similar benefits that fits your budget. And challenge them to go through all of the plans, including all their corporate plans. And in fairness to them, when you're on the phone with them, they know the calls are recorded. They will do just that. And if they come back with a plan that sounds promising, then the next question is, great, now tell me, how does that plan compare? What am I losing? What am I gaining? What stays the same? And people are often shocked to find that, especially if you're on the same plan for 5, 6, 7 years. And by the way, some of the plans that I see mentioned from time to time, they're in the market over 20 years. So those people have been hit by multiple price increases. So sometimes they're shocked to find they can save genuinely thousands or even hundreds on their cover, stay with the same company, and in some cases actually get better benefits. But if you don't engage, you're not going to get these deals.
So ring them up and get them to do the work.
That's the reality. That's the way to do it. If you try and do it yourself, it's torture. You will need counselling afterwards. And also, David, as well, what happens as well for some people, even when you do it yourself, you're going to have a list of questions. You're going to have to phone them anyway. So why not get them to do the work for you? And especially for people now who are on those same plans, like if you're paying more than $2,500 per adult, if you're on the same plan for 5 years or more, if you're not on one of these fantastic corporate plans, which anybody can join, or if you have everybody on the policy on the same plan, or if you have a young family and you're not getting free cover or discounted cover for some of the children under 18, they're all indicators that you are overpaying and you need to engage. And I suppose it's at the worst time. People are busy and they're distracted with other things.
They're worried about how to cook their turkey.
Exactly, and that's what's happening. And then they find the next deduction comes out of their account in January, and now they realise they're locked into another contract, they forgot about it, and now they realise what the price increase is.
Okay, now you're talking about rising prices, so there might be people listening who have never had private health insurance, and they might be thinking, well, I'm going to get a bad deal if I sign up now.
Yeah, and look, what I would say to anybody thinking of joining is that the insurance companies behind the scenes are launching new plans all the time because they know affordability is the big issue right now. So even though prices are going up, they keep bringing out newer plans and they base at a much lower price. So I would say to anybody thinking of joining, before you make any phone call or talk to any broker, what is your budget? How much can you afford to spend? You can get an entry-level plan for €500. Good mid-level plans right now are about €1,000, €1,200. And you phone up the insurance companies, tell them your budget, and once again, challenge them to find you the best deal that finds or that matches that budget. Right now, probably the two best deals for people joining in terms of mid-cover, Level Health, who are the new provider in the market, they have this Plan B 300 scheme, which is $1,027. And Leia Healthcare launched another plan which is called Access Health, which is $1,050. So once again, they brought out these plans to, I suppose, target that younger market who are looking for good value cover. So there still is good value despite all the increases that are taking place.
Okay, there's a couple of listener texts in, so we'll try and get through it. Hello, my current plan is Simplicity. Please advise cheaper plan with cover for orthopaedic and optical for over 65 years.
Okay, so that's a Leia plan, €2,790 the cost of that plan. I would say right now, if their renewal is the 1st of January, they should phone up Leia. Now, it's not huge savings, but it's much better cover. A plan with Leia called Prosper Advanced, €2,563. So they're going to save about €220 per adult, but David, they'll have far better cover. A new plan, they're going to get 75% back on every GP, every consultant, every physiotherapy visit, no excess to pay. I think there's €100 back on prescriptions each. It's one of the best private room corporate plans, and they'll also keep their full orthopaedic cover as well.
Okay, that's good advice. Now, I'm with VHI on Enhanced Care 350 day to day. €102 a month is about to go up. I think it's too much money to spend on health insurance at 31, but I'm not sure.
Yeah, and you know what, it probably is. So that plan right now, so the Enhanced Care 350 day to day is €1,299. Now, once again, the two plans that I just mentioned, so if they're not worried about getting a little bit back on GP and consultants fees, they could go to that Level Health plan, Plan B 300, or they could go to the Access Health scheme with Leia, and they'll save roughly about €280 for and still have very good cover. Unfortunately, there is other lower plans with VHI, but they'll have to take on more shortfalls, which I don't recommend.
Okay.
But they're not on a bad plan though. But then again, if they need to save money, those two other plans is where I'd look first.
Okay. Mick says, I'm 58, single, fit, and apparently in good nick for a man of my age. Well, I'm the same age, so I take exception to that. But anyway, I've had to have some MRIs in recent years. Is VHI PMI 5210 the best policy for me at $1,500 a year?
Yes. So his plan right now is $1,559 is the exact cost of his plan. Yes, that is a good semi-private corporate plan. He will be covered for MRIs. In fact, not just that plan or VHI, irrespective of which health insurance company you're with, you must always phone them in advance to check if the MRI scan centre you're going to is on their approved listing. If it is, you're fully covered.
Okay. A 72-year-old widower has VHI PMI 3613 plan. I've let it roll over for the last few years. Renewal is next March. Are there better options for him?
So they're on a very good semi-private corporate plan with VHI, currently costing €1,895. Now, here's the thing. We don't know exactly what rates are going to be in the market from next March. I would be saying to that person, you'd probably have to wait until January. So do they have good cover? Yes. Are they overpaying hugely? No. Could they possibly get better overall cover? Yes, there are other plans right now. For example, there's a plan with Leia called Prosper Care, which is $1,840. I'd probably prefer that plan because they get a private room and they get 75% back on expenses. But if they want to stay with VHI and pretty much keep everything that they currently have in place, they're not on a bad scheme. But I'm expecting VHI for the last 2 or 3 years has increased their rates on the 1st of March every year. So the likelihood is if they repeat that trend, there could be another increase coming. So I'd have to say to that person, we'd need to revisit your cover and ask that question again, probably around the end of January.
Okay, I think my renewal is the 1st of April. So I'm up for bad news, am I?
David, we need to talk to you sometime in February. Exactly. Because look, all that, and without scaremongering, but over the last 3 years, VHI 1st of March every year. Leia 1st of April, Irish Life 1st of January, and they've been repeating those trends every year. So for the moment, we have to expect that 2026 will be the same again.
Okay, we've a text in here from somebody. I've rung VHI every year asking them, can I get a cheaper plan with similar? And they never give me a cheaper plan. So there's somebody who's not benefiting from ringing.
I wish they just texted in the name of their plan and then we'd be able to tell them whether they're getting the best advice or not.
Okay, well, hopefully they'll get back in touch now. Currently on Irish Life Horizon 2, is there anything less expensive with roughly same cover for 2 adults and 2 kids under 11?
Okay, so they need to get their cover reviewed. Now, there's a couple of things about that plan. So the Horizon 2 is a step down from a different plan called 4D Health 2. Now, bear with me on this. 4D Health 2 is 2,052. Their plan is about 1,887 per adult. One of the concerns I have about the Horizon plans is that they have an excess or a shortfall on pretty much all cardiac procedures. So it's one of the few plans out there where they're not fully covered for cardiac. And if that's a concern, they need to change plan. To give that person an example right now, on the 1st of January, David, Leia Healthcare will put an offer into the market where you pay for the first child under 18 and the second child under 18 is free. So right now, they're probably paying about €400 per child. They could contact Leia today. They could check out a plan, for example, like Inspire Plus. Inspire Plus is 1,786 per adult. So they'll save about €100 per adult. And then basically they'll probably save about, they'll get the second child for free.
So that's 400.
Exactly. But then, so they're going to save potentially about €600 there in total. So what I would suggest is Inspire Plus. And by the way, this is just to look at this plan with Leia, but because they have 2 young children under 18, Inspire Plus for mum and dad and the eldest child, and a plan with Leia called Flex 125 Explore, which is free from the 1st of January. And that, if they like that product option, that could save them €600. And by the way, they'll now be fully covered for cardiac.
Okay, now we've one in from somebody who you're going to give out to. They're on the VHI Plan D for over 40 years. Which plan should we change to? We're in our 70s and need the orthopaedic in-hospital cover.
Okay, so now here's the thing. Plan D with VHI is now gone. So they're more than likely probably on a plan. VHI moved everybody, so they're probably on a plan called Premium Care. And if they are, Premium Care costs €5,331 each. Now, here's the thing. Anybody on that plan, you should only be on that plan if you will only go into Blackrock Clinic or the Mater Private in Dublin and you want the private room cover there. That's what that plan is for. If they're just looking for full orthopaedic cover, so what I'd say straight away, Premium Care is the current plan. Check out Premium Care Select. It's €400 cheaper each and you still stay with VHI. But I'd also get them to check out another plan with VHI. It's the old B options. It's called Advanced Care Extra Day to Day and it's €3,880. And a lot of clients that I've reviewed on their plan, when I show them this other plan, they like the benefits, they keep their full orthopaedic cover, and if they like that plan, they will save €3,000 between the two of them, and they'll still stay with VHI, and they'll still have superb cover. So they're the 2 options with VHI, Premium Care Select and Advanced Care Extra Day to Day.
A lot of money to be saved there. It's incredible, really, isn't it?
David, can I tell you, without mentioning any insurance company right now, there are too many people out there, and they're mostly people who are age 60 plus, who are paying $3,500, $4,500. I mean, for example, a customer last Thursday or Friday, €4,622 per adult. They're now with the same insurance company paying €2,417 each. They've saved €4,400, and they actually have, in some respects, slightly better cover. So, we're not talking about saving €75 per annum here. There are too many people still insured on these dated plans. Do they have good cover? Yes. Are they getting good value? No. And that's why they need help in reviewing their cover.
Okay, family of 6, mum and dad in their 50s, 4 kids, 17-year-old celiac, 12, 11 and 8. With Leia on Family Connect renewal in January, are there better options for our family?
Okay, so this is now, so if they're on the Essential Connect family scheme with Leia, so mum and dad, in my view, are paying way too much money. The Essential Connect family scheme right now is €2,488 per adult. I think that is too expensive for the benefits on that plan. So what I would suggest to do there is pretty much like somebody we said earlier, Inspire Plus for mum and dad and for the eldest child. And if they like that plan, they're going to save close to about €1,500. Now, they're already getting the free cover for the second, third and fourth child, because that's one of the plans that Leia tends to put on offer. So what I'd be doing is play the game and put mum and dad and the eldest child on a better plan and leave the rest of the children on that plan and continue to get free cover for them. But definitely the Essential Connect Family Scheme for adults it's an old dated plan. It's not the best value for money.
Okay, 61-year-old male in really good health. He says he might be able to afford healthcare for the first time in my life. Any advice?
So the good news is anybody can join irrespective of age. They'll have the same waiting periods irrespective of their age, and they can join any plan that's on the market. The only challenge for this person is the age loadings that were introduced back in 2015. So because they're 61, they're going to have 54% of an age loading. So if I tell them a plan that's €1,000, it's going to cost them €1,500. And that loading stays with them for the next 10 years. I would suggest if they're thinking about joining, check out those mid-level schemes. So for example, we mentioned the Plan B 300 with Level Health, and the Access Health with Leia Healthcare, all around €1,000. If they want to go with VHI, the Enhanced Care 350 with VHI, which is 1187, and also with Irish Life Health, they have the My Plan 350, which is 1,150 as well. So it is definitely worth looking at joining, but a lot of people who are older considering joining, the loadings puts them off because it's quite an extra charge.
There's a 73-year-old woman saying, what could I replace Simply Connect with?
Okay, so Simply Connect is a Leia corporate plan. Now, here's the thing. It's €2,483. If they want to keep full cover for the hips, knees and shoulders, they're kind of on the right plan. Yeah. But I mentioned a plan earlier called Prosper Advance with Leia. Pretty much the same money, but far better cover. But here's the thing. For anybody who's on Simply Connect with Leia or Simply Connect Plus, if they're not worried about having a hip, a knee or a shoulder replaced or cataracts removed in the next few years, they're actually overinsured. And I would suggest that person right now check out the Prosper Care Scheme with Leia. Fantastic cover, and today it's priced at 1,735, and if they like that plan, they could save €700 per year, stay with the same company and still have superb overall cover.
Okay, there's a listener says, on chemo at the moment, so I'm afraid to switch. I'm on Advanced Care 50 day to day.
So here's the thing, they have very good cover with VHI. The Advanced Care 50 day to day is €2,788. What I would say to anybody who's in the middle of treatment, we've always had a view that if you're in the middle of treatment and your plan is working for you, you don't really want to be changing your cover until your treatment is finished. But if that person is under pressure to reduce their costs, what I would suggest to do is to just engage with VHI straight away, tell them exactly which hospital they're getting their treatment done in and what type of treatment it is, and then tell them what the budget is. And VHI will be able to tell them exactly what lower cost options will basically give them the exact cover they need, but also save them money without having to change insurance company. And in fairness to the insurance companies are very good. They have this vulnerable customer policy. If somebody is let's just say struggling to pay their premium, but they're in the middle of treatment, they will basically try and accommodate you as best they can. So I definitely suggest they engage with VHI. If they want to save money right now, a plan worth looking at with VHI, PMI 4810, €2,131. It's a superb private room corporate plan. And if they like that plan, they could save nearly €700 and still be fully covered for their chemotherapy.
Okay, we've a text in. I was with Irish Life, swapped to Irish Life My Plan 350 day to day, swapped for maternity benefits, but realising now there are very few for almost a 30% price increase. Age 31, no health issues. Any recommendations?
Yeah, see, once again, this is where people need to be very careful. If you shop or if you change your cover based on cost alone without engaging with the insurance companies and getting them to explain what the benefit differentials are, you can often get caught out. So what I would suggest to that person, they probably, look, for me, I'd be getting them to phone the insurance company, phone Irish Life, because Irish Life will allow you to amend your cover mid-year. And they have lots of plans. For example, maybe one recommendation to give them, they've just launched a new corporate plan called Health Action 1. It's €1,300. For an extra €150, they may be able to upgrade their cover quite significantly. But if you phone Irish Life Health and Leia will allow you to amend your cover mid-year, whereas VHI won't. So I would definitely be getting them to phone up the insurance company, Irish Life, tell them exactly where they plan to get their maternity treatment in, what consultant they're going to, and they'll tell them exactly what plan they should be on. But check out, there's a new range of corporate plans that they've just launched, Health Action 1 or Health Action 2. They're the ones I would start with.
Okay, Dermot, good as always. An astonishing grasp of health insurance policies. And if people, we've had lots of texts in, we were only able to get to a few of them, but if people want to get in touch with you, they can do so at Health Insurance insurance.ireland.ie.
Yeah, a lot of this information is all on the website there for them.
Okay, thank you very much
My
for joining
pleasure.
us.